All right. So I think we'll get started. I'm Bill Beardslee, co-chair of the forum, and this panel is on measurement systems to assess individual and population level change. Speakers will describe innovations in the use of measurement systems to monitor changes in children's health at the individual and population level. And I think we can see by the active conversations during the break that there's lots to be said to one another in smaller groups. Most of the afternoon will be devoted to having those conversations around several different levels of measurement. But we're going to continue the theme that we had from the morning and focus on individual and population level change. And just as with our group of speakers in the first panel, this is a very distinguished panel with a great deal of expertise, far more experience in running many different programs than can be reflected in the 15 minutes that we've given to them. But I thought I would introduce all of them and give you some sense of the range of what they're doing so that you can think about asking questions and continuing the dialogue. Robert Orwin is a senior study director in the behavioral health group at Westat with 30 years of experience in program evaluation and 20 years of experience in the issues of homelessness, mental health, substance abuse prevention, treatment, and policy. Dr. Orwin has directed research projects for the Substance Abuse and Mental Health Administration, the National Institutes of Alcohol Abuse and Alcoholism, the National Institutes of Drug Abuse, the Centers for Disease Control and Prevention, the National Heart, Lung, and Blood Institute, and the Food and Drug Administration, and various other agencies. Again, one of the lessons we can learn in mental health is what's been done in physical health, what's been done in other areas. Jane Pearson, whom I've known and admired for many years, chairs the National Institutes of Mental Health Suicide Research Consortium. She's the Associate Director for Preventive Interventions in the Division of Services and Intervention Research, and she currently leads the staffing for the National Action Alliance for Suicide Prevention Research Prioritization Task Force, which includes the implementation of the first prioritized research agenda for suicide prevention. Greg Farber is the director of the Office of Technology Development and Coordination at NIMH. The office is responsible for coordinating common data element activities, overseeing the National Database for Autism Research, managing the NIMH component of the BRAIN Initiative, managing the Human Connections Project on behalf of the NIH Neuroscience Blueprint, and overseeing the NIMH Small Building Program. We'll expect him to give us a brief summary of all of these activities and how the brain relates to mental health issues in measurement. Catherine Bradshaw is professor and the Associate Dean for Research and Faculty Development at the Curry School of Education at the University of Virginia. Previously, she was at Hopkins. She's currently Deputy Director for the CDC funded Johns Hopkins Center for Prevention of Youth Violence and co-director of the NIMH-funded Johns Hopkins Center for Prevention and Early Intervention. She received an award from President Obama in 2009 for her research on the use of evidence-based prevention programs in schools and collaborates on federally supported randomized trials of school-based prevention programs. Again, an emphasis on prevention is vital. And finally, Karima Abdullah is the director of the National Community Anti-Drug Coalition Institute and vice president of training operations at Community Anti-Drug Coalitions of America, CADCA. She is responsible for executive and strategic direction of the Institute in order to make existing coalitions more effective and to expand the number of community coalitions with an emphasis on the development of coalitions serving economically disadvantaged areas. She's played an integral role in many agency accomplishments, including national recognition as a successful government partner by the White House Office of Faith-Based and Community Initiatives and the U.S. Department of Health and Human Services. So this is an extraordinary panel. Each of them has 15 minutes. Then we'll have some time for questions, and we'll have the afternoon to continue the dialogue. And we're going to go in this. We're going to go from this end, from right to left.